Hi, my name's Mallory,
And my name is Cameron.
and we did our project on contrast for auditory and speech training, or also known as CAST. CAST was developed by David J. Erdman. It's a structured therapy kit that focuses on both auditory and speech training. It includes a clinician's manual and about 150 picture cards, each showing pairs of words that differ by just one sound, such as B and P, or coat and goat. The idea behind CAST is that by listening to and identifying small sound differences, children become more aware of the way speech sounds are organized and produced. This awareness not only helps them reorganize words more accurately, but also improves their own articulation. It's a great example of how speech-language pathologists and audiologists can use visual and auditory tools together to support clearer communication. So why is CAST relevant in oral rehabilitation? Auditory training is one of the core components of oral rehab. It's all about teaching the brain how to process sound more efficiently. CAST fits into this perfectly because it uses what's called a bottom-up approach. This means it starts with the smallest building blocks, such as individual sounds, and gradually moves towards whole words and sentences. For children who use cochlear implants or hearing aids, this type of sound level training helps their brain learn to make sense of the electrical or amplified signals they're receiving. Research shows that auditory training can actually reorganize parts of the auditory cortex, which leads to better speech perception and language understanding over time. CAST is primarily designed for children between the ages of 3 and 12. It's especially helpful for kids with hearing loss who use hearing aids or cochlear implants. Even though they have access to sound, they still need structured training to tell subtle speech differences. It's also used for children with auditory discrimination or speech perception difficulties, which we often see in kids with language delays or auditory processing disorders. These children can hear sounds but can't always tell them apart accurately, which affects speech, reading, and spelling. CAST can benefit those with speech sounds disorders too. Practicing contrast pairs helps both hear and produce the difference. Children with normal hearing levels can benefit when using CAST, especially if they struggle with listening, attention, or sound awareness. Overall, CAST works best for younger learners developing foundational listening and speech skills through the same contrastive approach can be adopted for older children and adults. The main goal of CAST is to strengthen a listener's ability to discriminate, identify, and recognize speech sounds by using contrast pairs. This program takes a bottom-up approach, meaning it starts with easier, more acoustically distinct contrasts, like longer versus short or continuous versus interrupted sounds, and gradually moves to finer, more detailed differences. Some specific objectives include practicing 1, 2, and 3 syllable words, minimal pairs for vowels, and consonant contrasts that focus on manner, voicing in place of articulation. Essentially, it helps children build a solid foundation for accurate listening and clearer speech by training their ears to pick up on the smallest differences in sound. The CAST kit comes with everything a clinician would need to run an effective session. It includes a 30-page manual that outlines a pretest, cue and guidelines, and step-by-step training instructions. There are also 150-sided double picture cards featuring different auditory contrast pairs. These visuals make the activities engaging and help children connect sounds to meaningful images. The kit also comes with a divider and a pretest card to help organize materials and track progress during therapy. Overall, the structure of CAST makes it really easy to follow, even for clinicians who are new at using auditory training programs.
CAST starts with a pretest to establish the child's baseline for auditory discrimination. The clinician then presents select contrast pairs, starting with larger differences such as moo versus, and then moving to more subtle pairs like bat versus pat. During training, the clinician says each target word while showing a picture, and then the child identifies the correct image. If needed, the clinician uses cueing, such as lengthening sounds in order to clarify contrast, track accuracy, and gradually increase difficulty. Finally, the pretest materials are reused to reassess progress and monitor improvement over time. This is an example of auditory discrimination used in therapy.
So my name's Catherine and this is my assistant. What's your name?
Katie.
Hello, Katie. And we're going to do some good listening today, aren't we? Am I going to catch you out?
No.
I think I am going to catch you out. Now, these are some pictures that you've seen before. I'm using Jolly Phonics pictures. And this one, do you know what noise this picture makes? Can you remember? I think it makes this noise. Can you do that? That's really good. And look, I've got lots and lots of pictures here. And
There's more.
Yeah, there's more there, isn't there? This one says t, and this one says
Ah.
t. They're all the same, aren't they? Let's make those sounds together. T. And another one. T. And another one. Wow, all of those, and they all make the same sound. Now this one's a bit tricky because this one we say at the back of your mouth. Oh, who said that?
Me.
Was that you? You were so good. So we're going to do k. So this time we're going to do listening. I'm going to muddle these up. Do you want to see if you can sort them out for me? Okay, so I'm going to say a sound, and if I say that sound, you point to that picture. And if I say this sound, you point to this picture. Are you ready? T. Oh, fantastic. Okay, should we put it on a pile? What about this one? No peeking. T. Oh, you got it again. I can't catch you out. You're just too clever. There you go. What about the next one? K. Oh, you're so clever. Well done. So that's fabulous. You can hear the difference between the sounds. Now we're going to do sounds at the start of words. Look at my sparkly stones. Wow, can you see them all?
Yeah, we have lots of them at our house.
You've got lots of them at your house, have you? Right, okay, you ready to listen?
That one was sticking to my hand.
It was sticking to your hand, wasn't it? Now listen very carefully because I'm going to say some words. And if I say a word that begins with this, we'll put a sparkly stone there. And if we say a word that begins with this one, we'll put a sparkly stone there.
Yeah, it's upside down.
Oh, it is upside down. Right, are you ready to listen?
Mm-hmm.
Okay. Cat. Oh, now listen again. Cat. Well done. There you are. It begins with a k sound, doesn't it? Okay.
Hey, Dad, up his bed.
You just leave Mac for the moment. Are you ready to listen again?
Yeah.
Tin. Tin. Well done. You got the right sound that time. Ooh. Ready? Coffee. Good listening. Well done. You listened for that k sound, didn't you? What about this one? Toffee.
Toffee.
What sound does it begin with? Well done. There you go.
Why don't you tell me that?
And look, you've got all of them there. So we're going to finish. So just to have a little look, this is the picture that we've been using.
Oi!
And Katie got all of those right, so we're ready to move on to her saying the sound.
CAST is most effective when used for short sessions of about 10 to 20 minutes, several times per week. It works best as a supplement to other approaches such as reading, language practice, and contextual listening tasks. CAST can also be easily integrated into both clinical sessions and school-based therapy programs to enhance listening and communication skills. The strengths of CAST include the following. Its research-supported structure for auditory discrimination, it incorporates visual cues to maintain engagement, its framework adapts to each child's progress, and it supports integration with speed and language goals. However, with strengths also comes limitations when using CAST. The design is primarily for children and not adults, therefore not as universal to use. It emphasizes sound level listening, not full sentences or meaning comprehension. It requires consistency and clinician involvement for success, and it has limited large-scale published research on CAST. specific outcomes. And these are our references. Thank you.